Hello everyone, I am Dr. Madhavika Chaudhary from Sri Visista Ayurveda Hospital, Visakhapatnam. I am a BMS gold medalist and MD in Panchakarma. Today we'll talk about cervical spondylosis. We all are aware about what is cervical spondylosis and what Ayurveda says about cervical spondylosis. First we'll see that Ayurveda can correlate the term cervical spondylosis with manya stamba. Maybe we all are aware about cervical spondylosis, but in present era, due to this fast lifestyle and due to this computer world, we are just lacking behind our health somewhere. We don't know that where we are standing. In front of this world, we are just doing our day-to-day life activities with work stress and with bad posture and with somewhat unwholesome dietary habits and with all the junk foods, especially with these Indian roads and uh, our tours. We are just lacking behind our body posture, and day to day activities we are facing so many problems, especially in between middle age to elderly persons. At the age after 35, so many people are facing calcium deficiency as per the modern view, and due to their faulty dietary habits and work stress, mental stress, as well as sedentary lifestyle, we are facing all these problems. So results into there might be pain in the neck region, that is cervical region. We called it as degenerative procedure. That cervical spondylosis we can classify as a degenerative procedure or somewhat neurological. But what Ayurveda says about it? Ayurveda always recommended good dietary habits and good daily regimen. So Ayurveda can correlate this cervical spondylosis with manya stamba. So what is, there is two term, that is manya and stamba. So manya means mainly the neck region, that is cervical region, and stamba means stiffness. So what are the causes of Ayurveda which are responsible for this manya stamba? So mainly we will see diet related causes. So if someone is taking like oily substances or junk food which really affect the kapha dosha and vata dosha, which get aggravated in the neck region and causes pain, or someone is not taking some wholesome diet or balanced diet according to the Ayurvedic dietary plans or Ayurvedic dietary habits. So they might affected vata dosha and get lodges in spinal region and get a nerve affected, and a nerve can get irritated. So apart from these dietary causes, there are most important daily regimen or activity causes are there. So nowadays everyone is just indulge in computer work and mobiles. Due to this desk type of work and due to Indian roads, we always feeling and our neck region is not carrying that much load, means wear and tear phenomena got affected. So with the help of Ayurvedic daily regimens, and we can correct it. So apart from this, smoking is one of the main causes to get cervical spondylosis, and it affected our nerves and all the circulation. So mental stress like fear or anxiety can also affect cervical region, their neurological like symptoms. So after this the causes, then what are the signs and symptoms if one can feel, or patients are coming if cervical spondylosis is there, then what will be the symptoms? So mainly patient can feel pain in the neck region, or swelling will be there, or numbness and tingling sensation can be there. Patient can't move their neck region, or restricted movement can be there. So, by taking this unwholesome diet and following the sedentary lifestyle, the signs and symptoms can be there. So, after saying all these things, risk factors are really genetic factors. If family history of cervical spondylosis is there, these are the risk factors. And second one is patient is not following uh, like not doing exercises, good exercise, and having sedentary lifestyle continuously 8 or more than 10 hours he or she is working in front of the computers, or lifting heavy weights. After that, third one is if someone having a day sleep after eating lots of food, or after taking a full meal. So, this is also one of the reason for Manyastamba or cervical spondylosis as per the Ayurveda. Now, we will see that what Ayurveda suggests. In modern pathy, or in conventional intervention, we don't have lots of option apart from steroid, analgesics, painkiller like, and some physiotherapy, and last one is surgical interventions. These are the some not complete solution actually, they are giving only temporary relief. But Ayurveda can suggest you some complete relief, or there is a ray of hope in this condition. So, what Ayurveda suggests? That Ayurveda says that it is a complete, like comes under Vataj Vyadhi, which represents the circulation, and in some cases they are related to Vata and Kapha like disorders. So, Ayurveda gives you some Nidana Parivarjan, means what are the causes we have to avoid it. If patients is coming, we always suggest that you have to avoid the causes. We give them some dietary plans and daily regimen plans to avoid the causes. This is the first line of treatment. Then after that we suggest some medicinal treatments to avoid the pain, stiffness and all the things, and to improve the spinal flexibility and spinal health. After that there are some good and complete rejuvenation therapy which is really can say complete treatment for cervical spondylosis. We can avoid the surgical intervention. That's are the Panchakarma therapies. So, in Panchakarma therapy we have Snehana, that is body massage or spinal massage. Then Svedana, that is fomentation, which gives you relief from the stiffness, which enhance the health of your spine. And third one is very important, that Nasyam. Nasyam is very important in the case of cervical region, as Nasya helps a lot in neurological and special in Urdhva Jatrugat region, that the diseases which comes under upper clavicular regions, these all things covered with the help of Nasya. So, Nasya also helps you in neurological symptoms also, that is if someone is facing tingling or numbness or pain while movement, or any kind of stiffness is there. So, apart from this there are some small procedures like Griva Basti or everything. So, we can also do simultaneously for a better relief. So, with this all the treatment, we can also advise to the patients a good diet, some yoga, some meditations to avoid stress and to live a good life and healthy life. So, what Ayurveda suggests, these all things, that one should be healthy, one should not live with all the mental stress and with the diseases. So, Ayurveda always gives you a mental health as well as bodily health. So it always balance your dietary habits and daily regimen with the help of medications, and which gives you a rejuvenation therapy also. So it is not a temporary solution. The solutions will become for living a longevity throughout the life. So I always suggest that you have to be very careful while going to the any kind of Ayurvedic doctors or any taking Ayurvedic medicines, because self medication is not the solution. We have to treat it in a proper manner by a proper evaluation of your disease, whether it is a cervical spondylosis, manyastamba, or any kind of. So a complete solution with Ayurveda is always there. This is all for today. Thank you so much.